Have you ever noticed a tiny tremor in a finger or a slight stiffness that just feels a little bit off? Perhaps you or a loved one have experienced subtle changes like a softer voice or difficulty with balance that seem to appear gradually. Sometimes these small shifts can make us wonder if something more significant is happening. When considering early Parkinson's symptoms, doctors primarily assess them through a careful combination of a detailed medical history, a thorough neurological examination, and a close observation of both motor and non-motor symptoms. This comprehensive approach is essential for identifying the unique patterns associated with the condition. The core reason for this multi-pronged assessment is that there is no single definitive blood test or scan that can diagnose Parkinson's disease. Instead, the diagnosis is clinical, meaning it relies on a doctor's expertise in recognizing specific signs and symptoms. They look for key motor symptoms like a resting tremor, which is a rhythmic shaking when a limb is at rest. They also check for rigidity, which is stiffness in the limbs or trunk, and bradykinesia, which means slowness of movement and a decrease in spontaneous and automatic movements. Postural instability, or impaired balance and coordination, is another important motor symptom. Beyond these, doctors also consider non-motor symptoms which can actually appear years before motor issues. These include things like a loss of sense of smell, sleep disorders, particularly rapid eye movement sleep behavior disorder, chronic constipation, and changes in mood such as depression or anxiety. The presence and progression of these subtle indicators help paint a clearer picture for the diagnostic process. During the neurological examination, your doctor will perform various simple tests. They might ask you to walk across the room so they can observe your gait and balance. They may check your reflexes, muscle strength, and coordination. Often, you will be asked to perform repetitive movements, such as tapping your fingers or hands together quickly, which helps assess for bradykinesia. The doctor will also carefully watch your facial expressions and speech patterns. To help your doctor as much as possible, it is incredibly useful to keep a detailed symptom journal before your appointment. Note down when symptoms started, how often they occur, what makes them better or worse, and any other changes you have noticed. This provides valuable context. Your doctor will also meticulously review your medication history and might order blood tests or brain imaging to rule out other conditions that could mimic Parkinson's symptoms. For added precision, especially in complex cases, doctors sometimes use a specialized imaging test called a DAT scan, which stands for dopamine transporter scan. This scan uses a small amount of a radioactive tracer to visualize the dopamine transporters in the brain, which are often reduced in people with Parkinson's. It is important to understand that a DAT scan does not diagnose Parkinson's itself, but rather helps differentiate it from conditions that have similar symptoms but do not involve this dopamine transporter reduction, such as essential tremor. This tool helps support the clinical diagnosis made by an experienced neurologist or movement disorder specialist who possess a deep understanding of the subtle nuances of Parkinson's. Ultimately, the careful and thorough assessment by a doctor, combining your personal health story with a detailed physical examination and sometimes supportive imaging, aims to provide an accurate diagnosis. This clarity is the first vital step towards developing an effective management plan. An early and precise diagnosis empowers you to explore treatment options, make informed decisions, and actively manage your condition to maintain the best possible quality of life.